Hey folks, I'm Labor Allen, the founder of the Natural Health Clinic, and today we're going to be talking about things that if you knew, you probably would never have had or have your gallbladder removed. We're going to get into those things right after this, so please stay tuned. So it's very common for people to have their gallbladders removed. Millions and millions of people have. It's more common for females and during pregnancy especially, and that little factoid should actually give you an idea of what might actually be at the root cause of gallstones, the development of gallstones. So the first thing that's going to happen when you have your gallbladder removed is that you could very well develop a bile deficiency. So what happens is the liver is what's responsible for manufacturing bile. It manufactures about 350 milligrams in a 24-hour period, and then it moves that bile that it's manufactured over into the gallbladder, and the gallbladder stores it for later use, usually when you're eating a meal that has different fatty acids or it's greasy that you need to be able to digest. So when you do not have that gallbladder, that obviously immediately puts a further demand on the liver in order to produce adequate amounts of bile for what you're consuming. Long term, what this does is it greatly elevates the risk of developing fatty liver disease, the non-alcoholic fatty liver disease. Another common symptom, very common, is that people can develop diarrhea or constipation. And the reason is that bile interacts with the microbes and it lubricates the colon. So if you have a little bit too much, then it's going to go into diarrhea, anal leakage even, too little, constipation. You can develop very hard stools, very hard to pass stools, and that can be a sign of inadequate bile or bile deficiency. Very frequent to create bloating, indigestion, and of course, you can develop a systemic fatty acid deficiency. So what that might look like is that you start having very dry skin. You can even develop flaky, itchy skin. It can affect your hormonal system. It can affect overall cellular integrity, cellular health, because fatty acids are very important for development of the cellular membrane and healthy cells. There will also be certain oils that you'll find it very difficult to digest. So these can be things like very healthy oils like avocado oil, nut oils, olive oil, and of course saturated fats. Again, saturated fats are particularly important for our overall hormonal health and cellular health. Now, there are some fats that are easier to digest without a gallbladder, not because you don't have the gallbladder, but because these particular fats actually bypass the gallbladder and are digested in the colon itself. So these oils are like MCT, which is a fraction of coconut oil. You have to be a little bit careful with MCT potentially, because I found that some individuals are actually sensitive to coconut or coconut oil derivatives such as MCT. Butter is also a good alternative if you've had your gallbladder removed, as well as palm oil. Again, that's because these oils tend to bypass the gallbladder and be digested in the intestines. If you do not have your gallbladder, you may find two different supplements particularly helpful. That is a standard process cholesterol, which is a bile salts, and another one is that I use is from Cellcore called Advanced TUDCA. That helps the production of bile within the liver itself. Now, just because you have had your gallbladder removed does not mean that you need these supplements. Every client that comes into the clinic, I test to see if they do. Frequently they don't. They may need some other form of support for the digestive system because of having their gallbladder removed. But I just don't want you to think that just because you have had your gallbladder removed that you can take these supplements, everything is well. Oftentimes that will not be the case. In fact, you can create some of the symptoms that I mentioned, especially like diarrhea and stomach indigestion, if you are taking these things and don't need them. So if you found this information helpful, you can really do me a favor by liking, commenting, sharing. Excuse me. I appreciate that very much. It's really the only way that people can learn more about this information based upon the algorithms of the social platforms in this day and age. So thanks for watching. My name is Leigh Brunellen, the founder of the Natural Health Clinic. You have a great day.